It's always important to get the flu shot because we never know what kind of year it's going to be. Sometimes we have a mild flu year, we don't have many people hospitalized. Sometimes the flu vaccine matches the viruses that actually end up causing disease in that year, and we have a great match. But other times it doesn't go so well. Last year, you may not remember, but in Alabama, we had a preponderance of influenza B in particular, and that's a virus that affects kids really strongly. And in fact, we had to close down schools, seems like a million years ago now because we're in the middle of the pandemic, but we actually had to close down schools several times because of influenza outbreaks in the community. So this year, you can imagine that it could be a perfect storm. If we have a flu year that gets people really sick, people who are not vaccinated, plus we have continued COVID, it's going to really put people at risk for synergistic bad outcomes. And that's patients, people in the community. Also, you have to consider the hospitals, right? If you're a doctor's office or you're in an emergency room or you're a hospital, seeing the burden of COVID that we're seeing now and then adding on the additional burden of the winter flu could really, really take a huge toll on the system. So my advice is that anything we can do to reduce the likelihood that we're going to get influenza can only help not only us, but also the people who are around us and definitely our healthcare systems.